We saw a change over the weekend when the FDA, following public pressure from the president, gave emergency authorization to blood plasma treatment for COVID-19. And here to discuss that with us is Dr. Brian Hollenbeck, Chief of the Division of Infectious Diseases at New England Baptist Hospital. Good to see you.
Good to see you too.
All right, so this treatment, this is where current patients are treated with plasma from patients who have recovered. Now, health officials had initially said they needed more data on its use. So what do we know about this treatment now? Why the turnaround?
Well, convalescent plasma has been around to treat viruses for more than 100 years. So it's not a new treatment and it's pretty generic. So when COVID came around, it was really one of the first things that was tried. And there is some evidence that it could be beneficial, but it hasn't been fully studied in clinical trials. So there's a lot of unknowns with using this for COVID. So for instance, we don't really know exactly what dose should be given, or what intervals should be given, or who is most likely to benefit. But there could be some benefit for some patients.
So even if it, sorry, doctor, to interrupt you, even if it doesn't help, is there any evidence that it could actually hurt? It sounds like no.
Well, again, it's been around for 100 years, so we know the harms, and there are some harms. There can be allergies and transfusion reactions that may be kind of similar or analogous to a blood transfusion in some ways. So at least with this treatment, we do have a good handle on what the harms might be.
Let's talk about New York's governor saying that testing is going to be set up soon at JFK, at LaGuardia for incoming passengers. We don't know much about this, but thinking about colleges returning, more people traveling, is a move like testing incoming passengers something that other states or other large cities like Boston should think about?
Yeah, I think it's a great thing to be thinking about. There are increasingly different tests that are coming on the market that allow rapid testing of a lot of people for a fairly cost-effective way of doing it. And so testing at an airport or in colleges could be a really good way to open up the economy before we have a vaccine or before we have an effective treatment. There are some pros and cons to these kind of treatments, these kind of testing. Sometimes they're less accurate than some of the testing that we've been using, but they're generally pretty accurate for those people that have a very high viral load who are likely to spread to a lot of people. So they can still be helpful in identifying those types of situations.
The people that you want to catch. Okay.
Exactly.
Lastly, I want to ask you about this case out of Hong Kong, a man in his 30s. Doctors say that he has now gotten COVID-19 twice. The second time, nearly 5 months after the first, didn't have any symptoms, was just caught because of a traveler screening in Hong Kong. And so far, doctors and researchers are now saying he had two different strains of the virus. What does that tell us?
Well, it tells us that you can get COVID-19 again, unfortunately. This is something that a lot of us have been seeing clinically, people that looked like they were having a second episode of COVID-19. And this is the first case where it's really been proven that it's a different viral strain genetically. And so really confirming that people can get a second case of COVID-19.
So a lot more to watch there. Okay.
Yeah.
All right. Thank you so much, Dr. Hollenbeck. We appreciate your time as always.
Thank you.